Hello, class. In this video, we are speaking with Monique Castro, a counselor. Hi, Monique.
Hi.
Can you go ahead and please introduce yourself? Tell us a little bit about your profession, where you work, just very briefly about your training, and then any identities that you would like to share.
Sure. Hi everyone. My name is Monique Castro. I'm an enrolled citizen of the Navajo Nation. I'm also Chicana, born and raised in Northeast Los Angeles in the area of Lincoln Heights. And I am a licensed marriage and family counselor. I'm also the owner and founder of Indigenous Circle Wellness, which is a private practice where I provide psychotherapy services, consulting, an array of other different services and offerings for the community.
Wow, that's awesome. And where did you get your graduate training?
So I got my graduate degree from Mount St. Mary's University in psychology with an emphasis in marriage and family therapy.
Awesome, thank you. So can you please share what do you do and why do you do it?
So I'm gonna try to stay on point with being more specific to the therapy practice because I do a lot of different work in the community. And I can touch on that too, on how that's even possible because I have the practice and kind of the way that I've set up things for myself in being, owning a private practice as well as like choosing this field. But specifically as a marriage and family therapist, I provide counseling or psychotherapy services to individuals, to couples, to families, and that includes children. And I do that in my private practice office here in the City of Commerce. And so because I have my own practice and I get to make my own schedule, I provide those services on Tuesdays, Thursdays, Fridays, and every other Sunday. So that gives me time to do other work that I do in the community. And some of that other work that I do sometimes is directly related to the work as being a therapist, and sometimes it's not. So some of the specific work that's related to being a therapist is like I provide trainings and workshops to other mental health providers on how to provide culturally inclusive or culturally responsive care. So I train licensed other clinicians, social workers, LPCs, psychologists, anyone that's working within the community, whether that be mental health or even just working with clients in social services, since I have a background of working in social services for about 12 years. What else? I do a lot of presentations and workshops also for universities, some like this, but also doing larger presentations around the importance of including Native voices and the different, one is kind of, I just did one at Cerritos College, for example. It's kind of like an introduction to understanding, the communities that sometimes are very invisible, which includes working or being, Native.
Can you share why you got into this work?
Oh, that's a really long answer. There's so many reasons that I got into this work. So let me start with my community and my family. So a little story is that I was born and raised, as I mentioned, born and raised in Los Angeles. But I had two parents who were both addicted to different substances. So I had a father. My father was an alcoholic. My mother was addicted to cocaine at the time, or crack cocaine at the time. So I grew up with my grandparents. So I was with my grandparents since I was 5 years old, where they, I guess, adopted me at 5 years old. So during that time, I think throughout my entire younger life, I always wanted to understand their addictions. I wanted to understand why in some ways why did they choose these substances over their children. And so in college, I initially went into college or to Cal State LA when I got my undergrad in criminal justice, because I thought and so I'm also a first generation college student. I thought that the way to help people was to go into law enforcement, because I didn't know that there were all these different fields that I could possibly study or, be of a support. So I really started taking a lot of different classes and doing a lot of research on substance use, substance abuse, and having this interest. And I realized I didn't know at the time, but how it was so connected to psychology, right? And then from there, I decided that criminal justice wasn't the field I wanted to go into. I learned that very early on. I think it was my first class my first class at Castro, LA, and so I was kind of like on this, I don't know, venture to kind of figure out, okay, well, then what it is. I really want to help people, and I also was in high school and I did a lot of like mentoring and leadership. And so I'm like, what is it that kind of like brings all that in? And then I kind of was trying to, answer these questions, like, why did this happen? And of course, I, eventually fell into a class for a GE class with psychology, an intro to psychology. And I think that was like my aha moment of like, yes, like I learned so much in that class, and I was just like completely zoned in on everything that they were teaching, that I'm like, this is what I want to major in. So this was, I think, like my third quarter at Cal State LA, when I think I definitely had that moment, and I quickly changed my major into psychology. So I think there was, my own personal life experiences growing up also in a neighborhood where I also was questioning, like, why do some people have things and why do other people not? So it was a lot of like social things that I was like paying attention to as a child. And then going to college. So there was a lot of things that I wanted answers to. And I felt like psychology really opened a lot of those doors for me, to understanding myself, my family, my community, and then also ways to best support. The way I felt I wanted to do more preventative care, versus like what I seen was a lot of intervening, or like how I seen things that were like after the fact versus like who's helping before these things get this difficult, so that I think was, in a nutshell, there's so much more to it than that, but in a nutshell, like I think that's what's really been my my initial kind of entry into psychology. And then of course, as I was in grad school, I started to notice like that there weren't many folks of color in this field as far as being psychotherapists. I did some like general like research on it, and I think about 25% of therapists are folks of color. Of that, less than 1% are identified as Native American. So I knew that there was a huge need, that there is a huge need, and I really wanted to fill that. I wanted to provide. I wanted to be a psychotherapist in private practice specifically because I did not see that there was anyone in my community in private practice, and I wanted to make sure that I was fulfilling that area of need.
Yeah, that's huge. I think it's great that you mentioned all those different things that influenced your career trajectory. I know we have students in this class who are thinking about mental health, and we have other students who are still trying to figure out, what career is it that they want to get into. And I think you brought up a lot of good questions as far as, okay, well, what happened in your own life that you were curious about, as well as what was going on in your community, right? And I think when we are able to connect ourselves and our communities with our career, then we have a better sense of fulfillment and meaning out of our careers.
Mm-hmm.
So thank you for bringing that up.
Yeah, and that was also hard for me to, going through school, because school is very, college in general, it's very like Western based. And so when I was going through college, no one really said like, oh, Monique, you should go into private practice, or these are some folks that can help you along the way, there wasn't any model for me in particular, for myself at least. I didn't feel that. So I was like, okay, one, there's a need. I'd want to support the community in various ways. We have these different organizations and programs, but we don't have this. So there was a lot of, I think, building as I was going through both my undergrad and my graduate program and getting my 3,000 clinical hours, that I started to like, okay, how do I create this, and what supports do I need? What do I have? What skills do I have? And then what are the things that and where can I reach for other folks to that have been doing this, right? That may not be for my community, but how can I, get some of that information or that support to then create what I feel is needed.
Yeah, definitely. And I like the way that you frame that as far as, what strengths do you have and what access do you have in the community, because a lot of times for folks, when they think about working in underserved communities, it's definitely from like that deficit model of like, oh, there are all these things that are wrong, right? But then even if there are areas for improvement, right, trying to look at it from what do we have access to and what can we build on, right? Yeah, that's awesome. So I think you mentioned a little bit already about what your educational path was. Can you share kind of what jobs you had leading up to this point?
Yeah, so I actually, and I'm not going to go all the way from 12, but I actually started working when I was 12 years old.
Wow.
I didn't go that far back, but I will say that I've been working, for a very long time. And every single work experience that I've had have always been working with people, whether that be with the public, in my younger years, like working with the public, being on different volunteering. But my first, I guess, kind of professional job, as you will, that I think also really started being like the path into this field was I was working I was first working for I had worked for a nonprofit, and then I had applied for the Torres Martinez Tribal TANF program. So it's a cash assistance program specifically for American Indian Alaska Natives, somewhat like I mentioned, the CalWorks program. So I applied for this program. I had not had any previous experience working in like this kind of field. The position was as a case manager. But I did have other experience that I think that they seen was like what's helpful. So I worked with the Torres Martinez Tribal TANF program for 5 years. I started off there as a case manager. I was there in that position for a year. I got promoted after that into the education guidance counselor. And during this time, I had already started my master's program. And then from there, I was in that position for about 3 years as an education guidance counselor. So I was doing counseling, just not therapy. And I was working with adults on like re-entry into higher education. And then I became the self-sufficiency coordinator, which was, I oversaw the education and career department. And then I supervised about 8 to 10 different staff that were working in education and career services to help our clients. And then after that position, I graduated with my master's, so then I needed to move on. Although I loved working there and I still have great friends in that organization, they didn't have a clinical program and I needed to get my clinical hours. So from that point, I ended up working full-time with the United American Indian Involvement as a therapist, as a pre-licensed therapist there. And I provided therapy services or psychotherapy services for individuals, for children, and families. And then what else? So that's my clinical experience. And I guess prior to leading up to working with the Torres Martinez Tribal TANF program, I had worked on the weekends for about 6 to 8 months as a mental health worker. So I was working at a residential, it was a transitional home for young men, 18 to 21. So they had dual diagnosis, and I would work either on the weekends with them and do groups, make sure that they're being med compliant, take any case notes and stuff like that. So that was my first job that I got in mental health specifically, and then it led me to then all the other positions I had after that. And then I also worked so I did my clinical hours also at another organization, and this is pretty common of this field, is that folks have to do the 3,000 clinical hours, so you'll do the 3,000 hours at various locations. And I did mine at 2 different places. So United American Indian involvement through the 7 Generations program, and then I also did hours at the Relational Center, which was in West Los Angeles.
Wow. It sounds like a lot of great experience working in different capacities. You mentioned briefly that at some point you were doing counseling versus therapy. Can you just briefly describe what the difference is there?
Yeah. So counseling, in my position as an education guidance counselor, I was able to definitely support clients in, in guidance, and in counseling and psychotherapy are different, or therapy is different. And the main difference is this one, I would say, is a skill set and also the licensing. So as a psychotherapist, or I know we use it interchangeably. So as a psychotherapist or as a therapist, I am able to provide, I'm able to do assessments. I am able to, some assessments. I'm able to do assessments. I'm able to diagnose. I'm able to treat various mental disorders. As a counselor, that was not my role at all. Although I might have some general knowledge around maybe, certain diagnoses, and that role, I absolutely was not legally able to provide like psychotherapy services or diagnose. So there's a certain type of training, a specialized training that you get as a therapist that allows you to do that, to diagnose, to understand certain symptoms, and to treat those symptoms. As a counselor, it's more of like noticing and then referring. So, say a client is coming in and they're having a hardship, so one of them would be, yeah, I definitely would be open to sitting and listening. I would always be supportive in that way, but I wouldn't, be able to give them like a treatment plan, or I would more like, okay, well, it sounds like you're having a hard time in your personal life, like maybe this might be a good resource for you. So I would give a lot of resources and a lot of direction on like maybe what are other supports in their life that might help them. I would say also it was a little bit more of like a coach in a sense of like helping them kind of find what some of those resources are. As a therapist, and this is the other area where I like share with folks is helpful, is that counseling. So if you think this is I don't know, like the area here, counseling is kind of like everything up here, like what we see, kind of general. Therapy is really going really deeper. And there's a certain level of training and skill that we are then, we go deeper, but we also know how to get it back here so that our clients can leave therapy not feeling like they're still, where it's a really challenging area. So those are just some differences, and there's also similarities. Like I said, holding space together, being supportive. Those definitely across the board.
Yeah, that's really helpful to think about it that way, and also as far as what legally the differences are with licensing and whatnot. In terms of your career path, I think it's also helpful to recognize that you spent a lot of time with the Native community before you provided like the health services aspect of it, and that you were, despite your own lived experiences, right, you really got to know the community as a whole before you started to provide those services. And so I want to point that out as a great example for our students, that even if you want to work in a particular community, whether it's a specific racial or ethnic community, people with disabilities, or any other specific community, to build that experience with those community members, whether you're volunteering or working in something that maybe isn't necessarily directly tied to your long-term career goal, but you're still learning about that community and the different needs that they're facing.
Mm-hmm.
So, yeah.
Absolutely.
So, talking more about your career providing therapy, what do you think is the best thing about your occupation?
Oh, wow. The best thing is seeing the positive growth and change in my clients.
Mm.
It's just amazing to see, you know, how with support and whether that be through therapy, and a lot of the work, I'm a therapist, but the healing really comes from within my clients and the work that they put into making changes or having kind of taken the next step. And so seeing their growth is like, it's so beautiful. And how then that transcends into their family or into their other relationships. So that's pretty amazing. That's probably the best part, is to see that growth and to remind them, also when I, work with someone at the first couple of sessions, I always bring up later on down the road, maybe about 3 or 4 months later, like, remember our first session and where you were and like where you're at now.
Yeah.
Wow. It's even hard for them to remember because they're in such a better place. And then, all the different possibilities and things that come from that is great. So that's one of the biggest rewards for sure. Another one is being in private practice in particular. I have a lot of autonomy. I make my schedule. I get to really share with the world the way that I want to practice therapy, the way it feels good to me, the way that I know I can be in best support of the clients that I'm working with, versus working with an organization or an agency that says like, this is how you have to do it. Of course, like, I do have certain parameters as being a state, being licensed, as being a state, license, having a state license, but I still have a lot of autonomy, and I'm able to create what I'm really able to create a space that I feel is going to be most supportive for my clients. And so that's also really awesome. Everything from the decorations in my office to how I, what information that I share with the community, my logo, like everything has meaning, and I'm able to do that because I own the practice. So that's really awesome to have that.
Yeah, that's amazing. And how long did it take you to actually get your own private practice? Because I think that's something that sometimes students say, oh yeah, I eventually want to open up my own clinic, or I want to do this, I want to do that. Like, how long was that process, or how long were you hoping to do this before it actually became what it is now?
Yeah. So, wow. I had known that I wanted to do private practice almost immediately after once I graduated. I'm like, I want to go into private practice. But I also knew I had several years to get my clinical hours. So I'm like, I have some time.
Mm-hmm.
But in that time, in those about 2.5 years of, getting all my clinical hours, I would always write notes. I would always doodle on papers, like, what would my logo look like if I, one day, right? I always did a lot of little things. And if I was, just had free time, I did a lot of things that I knew that one day this is going to be for the practice. I didn't know exactly when that was going to happen. I just knew that I really wanted that. So then when it came down to like taking my clinical exams, and I was like, I would say about 6 months before I took my clinical exam, I'm like, once the moment I get licensed, I want to open my practice. And so I would talk about it. I would talk about it with friends. I would talk about it with my family. And like, this is what I want to do. So I went back to those doodles. and some of the notes that I had, and I said like, okay, I want to start making this kind of happen. So I spoke to like a CPA. I started to like look like what resources do I need to have? Who do I need to talk to actually make this happen? And so I actually owned the practice about 6 months before I actually opened it to the public, or actually 6 months before being licensed. So by meaning I own the practice is that I have it, the practice is considered like it's an S corporation with the state of California as a business entity, as a professional corporation. And so I had that paperwork saying that I'm the owner of it since August of 2017.
Wow.
And then from there, I started doing all the steps that I knew I needed to, what I wanted to have for the practice. So I didn't share this with anyone at the time other than like my closest friends and family. But in that, I was able to start creating like my branding. I was able to create like the forms that I needed. So I was getting kind of like scaffolding, like really getting all the pieces together, because I knew that my clinical exam, I was going to take it in January of 2018 of this year, and I wanted to have everything ready to go. So I was kind of I was studying and I was getting all the practice stuff together. So when I got my official notice on, I believe February 8th of this year.
My birthday.
Yeah. Oh, really? Happy birthday. That's February, yeah. So on your birthday, that was my official day of opening the practice. But I had already had my office. I had already had the office like furnished. Like I was pretty confident I'm gonna pass this test and I'm gonna open this office. Like I'm gonna have clients.
Yeah.
There was a lot of preparation going into it ahead of time. But no one knew what was happening. So when it finally opened, they're like, how did this all happen? I'm like, well, it was kind of like behind the scenes until I was ready to share it. So in February, I officially opened and got to see my first clients in my private practice.
Wow, congratulations.
Yeah, thank you.
That is huge. I mean, definitely, I think there's so much that you shared right there as far as, you know, one, like just studying for the exam, but like on top of that, like making your dreams come true, essentially, right? It's like this was a service that you wanted to provide to the community in your own way that recognizes, you know, what's going to work for the community. And then just doing all the paperwork and figuring it all out on your own, and just getting it all done. And you have clients, and it's amazing. Yeah, congratulations.
There's been a lot of growth since February. You know, like I said, opened in February. By, I would say, May, I noticed that the space, I needed to move into a larger space. That the space I had was, I mean, it was cute. It was perfect to get started off, and I assumed that I would be there probably for at least a year before I could have the capacity financially and you know, and just like learning that I would be able to move into a larger office. But my caseload quickly filled, which also showed me that, or reminded me, like there was a huge need because my caseload filled up so quickly, and I'm like, okay, I need a bigger space. So I moved into my larger space in August. And I honestly think I might need to move again in another 6 months.
Wow.
But the growth has been pretty quick, and I'm still learning a lot, right? I'm still learning a lot. I'm actually just hired on my first I'm hiring on my first part-time therapist to join the practice.
Wow.
She will be starting later this week. So.
Oh, that's so exciting.
Yeah.
Oh, that's so great. And I think, you know, sometimes we might feel nervous of like, oh, well, I don't really know how this is going to go. But, you know, sometimes you just have to like trust your instincts, and again, be in touch with what the community needs. And so it's so wonderful that in less than a year, you've already expanded so much, and like thinking about all of the people that you've been working with to help them grow. So that's wonderful.
Thank you.
Thank you. So on the flip side, what is the most challenging part?
The most challenging is time. I need more time in a day. Well, I would say that what is always challenging for me, and this is both within this work and in my life in general, and that's balance. It's always hard to stay balanced, and I strive for it every day. I, set goals around balance, and I have to do that in order to make sure that I like recenter myself to stay in balance as much as possible. And what I mean by that is like how, when do I know that I'm exhausted? Like when is it time to take a break? Making sure that I set certain boundaries, that being with, of course, with my clients, as well as like family and my personal life, like not being, I would say that before I was like a yes person to everything. Like, yeah, I'll do that. Oh yeah, I'll be there. Or there's an event, I'll be there. Or yeah, of course. And I would be like running across town trying to get from one event to the other because or from like a family event to a community event, because I love my family and I love my community and I want to be everywhere. And what I realized is that that's not fair. Well, that's not helpful for me, and it's definitely not helpful for my family or community or my clients if I'm just kind of like all over the place. It's always a challenge for me to like say no to things, because sometimes I don't want to say no, but I'm like, I technically don't have the time. Or sometimes it's a client who's like, I really need to see you, but the only time I could see was at 8. And I'm like, well, I have like a hard cutoff, but like I don't see anyone past 8 p.m. because I'm not the best person after 8 o'clock. Like that's pretty close to my bedtime. So that's both, so that's challenging sometimes because I have to say no to things that I wish I could say yes to, because there's just not enough time and I'm a human and I also need rest. And then of course, some folks say, well, isn't it hard to hear a lot of challenging things that is hard, but it's not the most challenging part of it. To me, it's something that I guess it's not the most challenging for me. It's mostly with the time and rest and trying to balance sometimes is probably the most difficult, especially when I don't have a schedule, right? Like a job that I'm there from 8 to 5 or something. I can essentially say, yeah, I could, see you and do this at any time, but I have to make parameters and boundaries around my time and decide sometimes on like what is something else, how you can attend or not attend or do or not do.
Yeah. That's definitely a struggle that I have of how do you say no to things. And so that definitely makes a lot of sense that you need to set those boundaries for yourself. And just because you do have the freedom as the owner of your own private practice, that doesn't mean that all of a sudden, like, you can just work 24/7, right?
Oh yeah, I did it, there's been moments where I'm like, it's like 10 o'clock at night and I'm like, oh, I just had this great idea and like, let me start writing, about it, or let me start working on it. And then I have to catch myself and say, no, like, this is the time that you should probably be resting and not be on your computer. So I've also had to check in with myself a lot, especially in the beginning, because I had a lot of excitement and adrenaline around it. And now I'm like, I have to remind myself, like, when, no, right now it's time to be at home and just relax and not work.
Awesome.
Yeah.
So last question before I shift to advice. As a professional, how have you seen culture and language influence the care and services in your field?
Yeah. Hey, sorry, my colleague and friend just came into the space.
Hello.
Fellow licensed marriage and family therapist. So one of the things, let me see, that language and culture. So a lot of the work that I do is very specific around cultural inclusion. And I feel like that has, one, because I know it's super important. It was super important for my own journey in therapy. And one that I've seen when working with the community is that when culture is acknowledged and included, folks feel like they can be their full selves, and this includes language.
Mm-hmm.
So although I don't speak Spanish fluently, I always encourage my colleagues who speak Spanish to share if there's like a certain word or a way of describing something, to share it in their language, because that's going to come, it's really going to help with what they're trying to say because of the translation. And they can explain to me afterwards like what they can translate it for me if they wish to, and sometimes I don't even need to have that translation, just like for them to express it. So healing being really important in, you know, and for me, what it is that folks can be them full self. So that's where I feel like culture and language is super essential and important. Even if it's a language or a culture you're not familiar with, that folks feel that they have that space, and the therapist can hold it with them, you know, as best possible.
Yeah. I think that's a great point, that as long as the person is able to be authentic with themselves, right? Clearly, it's great if you do speak that same language, but if you don't, like being able for them to share authentically in their own tongue, right? It makes a difference to them. So what advice would you give undergrads who are interested in your field?
Undergrads, wow, like almost talking to my younger self in undergrad. What would I tell myself? You know, whatever the field that you're in there's always multiple paths to go down in that particular field. So in psychology, I learned that there's like 100 different ways that you can use that degree of psychology. I would say to work in the community that you feel in your heart is where you'd want to be. Get that experience. You'll know if that's where you want to be, because it's even if it comes with challenges, it's still going to feel very fulfilling. So kind of start thinking about what is the community, or what is it that you see yourself doing. Start getting that experience. I will say that, you know, I know it's hard to be a student, especially if you're a full-time student in undergrad, but try to make every effort as possible to work part-time or volunteer or do something that you can start learning to see what is really like the area that you want to go into. So for me, I started to also notice like, oh wow, I'm really good at working with, I do really well working with people. And for whatever reason, people actually care what I have to say. So I started like, what are the things that I should do? And you know, and people would say, wow, Monique, like after I talked to you, like that really was helpful. So I'm like, wow, like I had some type of impact here. So I started to research going into counseling psychology. And even then there's so many different avenues of how you can become a therapist. So I did a lot of research. So I would say also just do a lot of research, ask people in the field, meet with them. You know, if anyone's interested in this field, whether or not you're interested in private practice, like I'm one person you can reach to and like have a conference call with or go to coffee with. I've sat with so many students to share with them. So finding people in the field that you're interested in and like have a meal with them or check in, you know, get a mentor. So really getting the support that you need early on is, I think, really essential. I've had like so much support by so many different people in various ways. So
yeah, that's awesome. Definitely. That's one of the things that we're trying to get students to do. One of their upcoming assignments is to do an informational interview. So hopefully they take your advice and find someone that they can really learn from in that process. So final question, this actually comes from one of our students, Mac. Hello, Monique. Did you have to change your counseling method or approach to better serve specific clients? What are some things you have to do differently to be more culturally respectful toward Indigenous clients compared to clients of other ethnicities or nationalities?
The answer is I did have to make some changes. So one of the, well, I'll say some changes, and one is also I learned, and I'm still learning, that I don't necessarily need to, there's different theoretical orientations. I don't have to use them if I don't feel that they fit for the population that I'm working with. So what I have learned is that there's certain theoretical orientations that I was taught that are helpful, and there's some that are not helpful at all in the population that I work with. So I choose not to use them. And then I'm now learning and continuing to learn about different modalities that I feel are helpful. And also some of the things that I've just learned as being just learning in my community, which is like taking the time, quality over the quantity, you know, sitting and holding space with clients, not rushing through questions. I don't rush through questions. There's certain therapists that might have like a checklist. I don't have a checklist. There's certain things that I do that are different because I know that that's the best way that's going to be supportive of the community that I serve. And, you know, so there's been different ways that I've done that. But I did have to check, and I did have during my graduate program, like find a theoretical orientation that I felt was the most aligned. And that was relational therapy, relational Gestalt therapy, which is very inclusive of community, family, interdependence. So a lot of the same value systems as Indigenous folks. So that was important. And so I include some of that as well as like my own Indigenous knowledge and value systems into the work that I do. And then of course, bringing in everything that my clients also have to offer. So like I said earlier, like their healing is really, the healing that they have is really within themselves. So really like helping them harness that leadership in the therapy space. And I'm sorry, I have like one more minute because has a client, and then we have to head on out.
That's fine, but thank you so much. It's been so wonderful talking to you and learning from you. Congratulations on all of your success thus far, and I really appreciated hearing from you. Thank you, Monique.
Bye. Thank you.
Bye.